Namaste. I am Dr. Shailesh Kelkar. I am neuro and spine surgeon practicing for last 30 years in Nagpur, and I welcome you to our own channel, Neuro Bytes by Dr. Kelkar. The very intention of coming back to you with this episode is to overall clarify the various things about confusions, particularly about a neurologist and neurosurgeon. Neurologist primarily is a physician and he treats patients after going through the symptoms and signs and treats with the medicines. Neurosurgeon is actually, he also goes through the signs and symptoms and then he treats with medicines. And if the patient has got some condition which requires surgery, then the patient is taken up for surgery accordingly. The second point is whether a neurosurgeon, visiting a neurosurgeon means surgery. It's a myth. Actually, when a neurosurgeon is visited, as I said, logically speaking, he examines the patient, he looks after the investigations, and then he advises whether medical treatment will help the patient. And in some cases where there are surgical cases where there are, suppose for example, a tumor or there is a slip disc, then the surgeon is very likely to advise that this patient requires surgery. So there is a clear-cut understanding about all this. The next myth is that neurosurgeon only treats head injuries. It is not so. Head injuries are definitely treated by neurosurgeons only, but other than that, there are multiple brain and spine conditions which require neurosurgeon's role. Particularly in brain, for example, brain tumors are there. Sometimes you have post-infection fluid collects in the brain, which is called as hydrocephalus, which requires some shunt surgeries. Apart from that, head injuries are always there, and spine cases also, cervical spondylosis, lumbar spondylosis, slip disc, these are the conditions where the nerves can get compressed, and then this requires surgical intervention. The planning has to be done and the planning has to be executed, and this is done by a neurosurgeon. Now the next question asked very commonly is how risky is this neurosurgery or the spine surgery. If you look at the history, the progress in this field has been tremendous in last 30-40 years, and there is a lot of improvement as far as imaging is concerned. The radiology, particularly the CT scan, the MRI scan, they have made a huge impact on the understanding as well as the treatment which is delivered to the patient. Apart from that, intraoperatively, the equipments which are used are also important. The microscopes, the other drilling systems, the QSA, just to name a few. These are the instruments which are very high precise gadgets which are used in the operation theater, and they make the surgery more safe. So all in all this exercise is meant for making the procedure safe and for the betterment of the patient. There are always going to be some risk involved in these procedures. They have to be understood equally by the patient, the relatives, and the doctor, treating doctor. So if you can consult a surgeon at an early stage of the disease process and proper investigations are done, and if the patient requires some surgery, the surgery is done in good time, the results are very good and favorable. So I always advise, so to be in time or a stitch in time saves nine. That is a old proverb and that should be followed. I wish you all good health, and we will see you again with our next topic concerning brain and spine, some of the upcoming topics in our next episode. Thank you very much.